Assalamu alaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine. Today, our topic of discussion is delivery, the sequential topic of pregnancy followed by delivery. So, the definition of delivery is expulsion or extraction of the fetus from the mother's uterus at full term or at birth. This usual term is completion of 280 days of pregnancy, and the delivery occurs earlier before 280 days. It is called premature delivery, and also after this 280 days it is called post-mature delivery. The legal issues that is concerned with the delivery as term, the infanticide, that means killing of an infant within 1 year, concealment of birth, criminal abortion, nullity of marriage when the delivery occurs shortly after marriage, divorce, the wife being apart from husband but the calculation results delivery, execution from the judicial sentence may be delayed up to 6 months after delivery, deferring trial, following rape, kidnapping or seduction, as the pregnancy can be resulting to delivery. The delivery in underage, as the age is below 16 as a result of rape, is also a legal concern. Criminal breach of trust, blackmailing, disputed paternity as well as maternity, legitimacy, inheritance of property, high maintenance allowance, higher compensation after delivery, also legal provision of leave after delivery with affiliation cases. So, first we need to describe this delivery by the physical signs. The physical signs in case of living as well as death is concerned in legal aspect. In living body, the general signs as exhaustion, pale, ill-looking or slightly feverish is main concern. Also, the signs are observed in abdomen are stria gravidarum on flanks and linea nigra in midline. The signs also observed in external genitalia as well as internal genitalia. External genitalia includes the breast changes. Also, internal genitalia includes labia majora, labia minora. Fossa navicularis and posterior commissure. Intermittent uterine contraction is main term as the maintain up to 4 to 5 days. The vagina, cervix and lochia is concerned. So, the lochia is termed as a discharge from the uterus within 2 to 3 weeks after delivery. It has sour, disagreeable odor, gradually changes its color and consistency. The composition of this lochia are red cell, vaginal epithelium, decidual debris and leukocytes. Types of lochia is 3 types: lochia rubra, lochia serosa and lochia alba. Lochia rubra is within the first 4 to 5 days when the color is red and the composition contains large clots. Then the lochia serosa is the next 4 days that color turns into serous color and may remain pale. Lochia alba is after the 9 days. The color changed into yellowish grey color and becomes turbid in consistency, and gradually it continues to disappear. Now, the signs of recent delivery in dead body. All the local signs mentioned in the external genitalia as well as internal genitalia and the general physical signs are present. The only signs which prove the delivery is appeared is the os uteri. The size of the uterus vary with the period of gestation and the time after delivery at which death occurs. The uterus remains soft and flabby at day 2 or first day, and the gradual shrinkage and resumes its firmness as normal. In a multiparous woman, the internal os is not well defined, while the external os is transverse, irregular, fissured, and may admit the tip of the finger. In nulliparous woman, the internal os is well defined with the external os rounded, with a dimple in the center and the orifice is closed. Regression corpus luteum will still be detectable in one ovary. Now, those were the recent signs. So, what will be the remote signs? In living case, the signs always present in as abdomen, in breast, the hymen, which is specifically called caranculi minoriformis, old heel scar at the posterior commissure, vagina is comparatively capacious and some degree of loss of rugosity, external os is transverse slit-like appearance. In case of dead body, the uterus is larger, thicker and heavier. The walls are concave from inside, forming a wider and around cavity with the capaciosity. The body of the uterus is twice the length of the cervix. The cervix is irregular shortened and the external os is not well defined. So now some important terms regarding this delivery. A supposition child, also called fictitious child, a woman sometimes plea pregnancy and delivery of a child, or a place living body for a dead one, or place a male body in case of female, and may finge the pregnancy and delivery later after this living child as if it is her own. This is called fictitious child. Affiliation case is another term. A woman sue against the alleged father of her child that is illegitimate in a civil court to meet the expenses of burden of this child which the court fixes. Legal issues regarding all these cases is inheritance of property, blackmailing, finging a male person, when widow claims higher compensation from the husband's employer after the husband's death. Also bringing charge of breach of promise of marriage from the alleged father. Now, some terms are there as superfecundation and superfetation. Superfecundation means the fertilization of two ova which have been discharged from the ovary at the same gestational period. The average period is 280 days mentioned before as 266 days of date of fetus. The maximum period may be 328 days and the minimum period 210 days may be termed as viable day in 180 days. Superfetation. It means the fertilization of the second ova in a woman who is already pregnant before. Later, two fetus are born either at the same time showing the different stages of development or two fully developed fetus born at different period varying from 1 to 3 months. These two are primer concerned in case of legitimacy. Now, posthumous child. A child who is born after the death of its father within 280 days plus minus 7 is termed as posthumous child. The legal issue arise regarding these are legitimacy, inheritance of property, more compensation claimed from the employer or father, compensation cases, slander against the woman. Another term is precipitate labor. The fetus die at the labor when the victim is usually a newborn infant alleged to have died in the sanitary toilet or bathroom. It is common in grand multipara and in such women who 3 stages of labor merges to a single stage. The fetus is expelled out suddenly with onset of labor in a very short period, causing death of the fetus usually by injury to the head. Concealment of birth. It is prior to abortion. It is a birth concealed intentionally when there is a punishable criminal offence. According to section 318, as per penal code states that whoever secretly bury or otherwise disposing the body of the child, whether such a child die before or after or during the birth, intentionally conceals or endeavours to conceal birth of such child shall be punished with imprisonment of either description for a term extent may up to 2 years with or without fine. These are the primer concern regarding the pregnancy as well as delivery, and the legal aspect of all these are the consent and also the resultant of the offences, maybe civil or criminal suit, and in these cases the child's introduction as well as the addressing the child, whether the child is legitimate or illegitimate, the final concern regarding the that means the legitimacy and illegitimacy as well as the blackmailing a person or inheritance of property, all these are concerned with these cases. That's all for today. Thank you. Assalamu alaikum.